Dear colleagues and participants, I am honored to join you at this 10th session of the AMIS Rapid Response Forum. Today, my intervention is intended to contribute to the discussions under Agenda Item 3 on policy matters, and more specifically on WTO's response to the ongoing health crisis. Ever since COVID-19 was declared a public health emergency by the World Health Organization, the WTO has paid greater attention to improving policy transparency at a multilateral level in all trade-related areas, including agriculture. A dedicated COVID section was created on our website, which contains links to all our AMIS institutional partners. WTO members reaffirmed their commitment to a fair, predictable, and market-oriented agricultural trading system. Several like-minded groups of countries issued confidence-building statements calling for global and coordinated solutions to shield global supply chains for essential agri-food and medical products from trade restrictions. Simultaneously, members renewed their engagement in WTO bodies. Country participation in well-established monitoring mechanisms increased, and the rate of submission of official notifications improved significantly. In many WTO committees, COVID-19 became a standing agenda item, which greatly enhanced the quality and timeliness of information exchange and policy dialogue. Ultimately, as documented in WTO's COVID-related policy monitoring, WTO members overall exercised restraint in introducing trade restrictive measures during the pandemic. It is also reassuring to see that policy responses and member-led initiatives have largely been designed to safeguard food security and facilitate international trade flows. Our most recent estimates point to an 8% rebound in the volume of global merchandise trade this year, after falling by 5.3% in 2020. For the purpose of this policy session, and drawing on policy monitoring functions that we conduct both at the WTO and AMIS, I would like to highlight four main takeaways. First, there is renewed momentum to pursue the agricultural negotiations with a view to delivering meaningful outcomes at the 12th Ministerial Conference across all topics under consideration. This is especially true for production and trade distorting support, where government assistance in the form of direct payments, farm income support, public stockholding, and food assistance to vulnerable populations continues to be rolled out to counter the health, social, economic, and food security impacts of the pandemic. Second, around 80 members have agreed not to impose export restrictions on the humanitarian food procurement carried out by the World Food Programme, a crucially important AMIS partner. This outcome is, in my opinion, a significant achievement towards international policy coordination. Given the reform program that is mandated under the WTO Agreement on Agriculture, a multilateral outcome is still achievable on this issue. Third, it is important to highlight the growing pervasiveness of non-tariff measures in agriculture trade. In the wake of the pandemic, non-tariff measures represented close to 35% of all grain and oilseed policies reported in the AMIS Market Monitor in 2020. As traders sought to facilitate trade and streamline operations, many non-tariff measures in the form of technical and quality standards, conformity assessment procedures, inspection and testing requirements, labeling standards, and phytosanitary measures were either waived, simplified, or implemented through electronic certification means. In fact, the increased uptake of yeast certification during the pandemic has not gone unnoticed. This is also an area where the WTO is collaborating with institutional partners, including FAO and the World Bank Group, to improve market access outcomes for developing countries under the Standards Trade Development Facility, otherwise known as the STDF. Finally, despite the rather optimistic trade outlook for 2021 I shared earlier, We should be mindful that a strong and sustained global economic and trade recovery remains conditional upon the rapid production and successful deployment of vaccines worldwide, particularly in developing countries. An unpredictable health environment will certainly have ramifications for the global economy and impact on our deliberations today as we consider the future of the AMIS initiative. I'm looking forward to an in-depth discussion among all AMIS colleagues and stakeholders. Thank you.